Yes. So, Namaste all. On behalf of National Medicals Organization Tamilnadu, I welcome each and every one of you to this first rapid review program for revision of second MBBS exam portions. Okay, so we had some 870 registrations, so of which the first 100 people are let in. So after the meeting, we will upload in the YouTube link and then we'll share the link also. So we'll now start the session with the NMO mantra, which means like I do not wish for the uh, kingdom or heavens or a rebirth or power or money or anything. What I wish for is only to take away the distress, disease part of all living things. So, this being very appropriate for the medical profession, NMO has taken that as the NMO mantra. So, we will chant Om thrice and then do the NMO mantra and start the session. That is the routine every day. Okay. I'll chat Om thrice. So you may join in your own respective places, whoever wants to or prefers to. No issues. Om. 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 न त्वहं कामये राज्यं न स्वर्गं न पुनर्भवं कामये दुःखतप्तानां प्राणिनाम् आर्तिनाशनम्. Thank you. So National Medicals Organization, I'll give just a 1 or 2 minutes intro. I'll not take more time. So this is started in 1977 in Banaras, and then it is an all India organization with a heavy presence across medical colleges in India. So in Tamil Nadu, we are active since it's present till 1994 since, but we are active among medical colleges around from 2022 till now. So we have reached to 25-30 medical colleges. We frequently conduct medical camps in the underprivileged sections, in the slum areas, in the tribal areas. We go for treks. We go for cleaning campaigns. We have revision classes online. We have organized quiz. So frequently we are active. So we will try to engage you. If you are interested, you can take membership. There are student membership of 500 rupees and life membership of 1500 rupees. So if people are interested, you may express and then I will share the link in the group. For now, this is a 11-day program. So tomorrow it is between 4:30 to 6 and we will go live stream. For today only, because 24 hours time was required since after 50 subscribers have taken the YouTube channel. So we are starting the live stream from tomorrow. Today we'll have the recorded session. You can inform your friends and also share the video to your friends. So I am happy to introduce Dr. Chandramauleeswari ma'am, Professor of Pathology from Madras Medical College, to inaugurate the first session, the pathology, the second paper order, first half. Ma'am will take. Over to you, ma'am. Thank you. So if I leave, maybe one more person can be let in. So for that, I am leaving the session. Jitesh, you may end the session with the Shanti Mantra. Okay?
Yes, ma'am.
Thank you. Thank you all.
So, shall I start? Good evening. Am I audible?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. So, ma'am, good evening. Happy to be here. So, thanks for the opportunity. I am actually a newborn child only in NMO, but I've been to multiple such meetings and I really appreciate the human values the NMO stands for, especially the value with which they approach the MBBS students. Helping them out in their exam curriculum as well as in extracurricular activities. And even now, honestly, madam, I don't think she can be matched at all. She says, I will leave because it will enable one more people to join. So that is actually the essence of NMO. And with that, I would like to get into the academy. And I'm happy anybody will unmute themselves and ask a few questions then and there also. It it is not, I mean, it need not necessarily be a monologue. So participation is welcome. And I'm starting with the pathology importance. So with regards to pathology, it's to be understood that it is a very, very vast subject. Nobody can master any subject for that matter, leave alone pathology. But pathology is very volatile also. And you being second year student, you will come into pathology with little understanding, very, very little understanding, as little an understanding as can be imagined, without even the knowledge that everything you read in pathology is applicable to the clinical medicine. So what you are here for as MBBS student and what would interest you as MBBS students is only anything and everything related to patient care. So you are here to become a doctor and you think the basic sciences, I mean, I'm not blaming anybody here, but the basic concept is actually misunderstood is my concern. So I'm just voicing it out here as well. So everything you read in basic science is applicable. Each and everything is applicable to clinical science. And basic sciences can never be separated from the clinical science. It has to be understood. Okay, very good. So in relation to patient care, if you study pathology, it is going to be the most interesting subject ever. Being a pathologist, of course, I cannot say anything, anything less about pathology. So not only because of that, but the truth also is that pathology understood properly in the perspective of clinical care is the most interesting subject. Okay. So with that brief introduction, I will delve into the realms of the exam point of view because that is why all of us are here, isn't it? So pathology actually can be divided, as Madam rightly said, it is in two parts. The first part is called as general pathology and the second part is called as systemic pathology. And every child here, I'm sure systemic pathology is more interesting. I hope you would agree with me. More interesting when compared to general pathology. General pathology is dry, okay? And as I told you in the beginning of the lecture itself, the dryness is basically because of the ill understood nature of general pathology. So if you understand it correctly and if you learn to apply general pathology, it forms actually the core of systemic pathology. Okay. So again, just a small introduction. That's all. I will not bore you with more and more introductions about the subject. But just to kindle your interest, I'm telling you all. Okay. So now moving on to the important questions in general pathology. The first chapter is cell injury and adaptation. So I'm telling you here, I think Jitesh is also there. I hope I understand that you are an MBBS student, second year student. So
Yes.
anything when I'm crossing your level, please intervene. Okay, I really don't want this to be a monologue. It would be really interesting if any of you can pitch in with a few questions or you can break the monotony. Like you can avoid boredom by breaking the monotony. Here and there, whatever input you want to offer, also you can offer. And then and there, you want some more questions to be answered. There is a lack of clarity in whatever I'm speaking. Also, I would really like you and I would request you to intervene. Okay. So, the first chapter is going to be the cell injury and adaptation. And here, the most important question for long answer will be define necrosis. Okay. So, mention the types of necrosis, explain the causes of necrosis, and describe the pathology of each type of necrosis. Okay. So here, the necrosis, definition of necrosis, all of you will be able to understand, I suppose. And necrosis has to be understood very well in perspective because necrosis forms the basis of everything, including myocardial infarction to all other types of necrosis. Coagulative necrosis and liquefactive necrosis are the two most important types of necrosis which should be understood. And other types of necrosis also are there. You people will have to go to the website. So that's a very, very important long answer. Explain the cause of pathology and each type of necrosis you have to study and get your answer. Okay. And while writing a long answer, it is very, very important in a university exam to remember that you have to give adequate number of subheadings. Okay. Subheadings is so definition. Define necrosis means you can put define necrosis, underline, and then you can always make a flow chart or a tabular column, or you can describe a little and then come back to the flow chart or a tabular column. So, for example, here mention the types of necrosis is written, isn't it? So this actually can go in the form of a tabular column, and in the tabular column you can mention coagulative, liquefactive, gaseous necrosis, and other types of necrosis, and you can write the distinction of each and every type of necrosis in the tablet column as a summary. Okay, because it is a long answer, you will have to write a little bit of paragraph as well, jot down the points, put flow chart, and make a tabular column, because there are 3-4 types of necrosis which you are going to describe about. And at the summary, as a summary, you have to like divide your answer in the form of subheading. Okay, so definition followed by type, followed by pathophysiology, followed by example, and then at the end you can give a summary of all the points which you have written so far. And in the summary, you can always put a tabular column and make it more attractive so that the examiner correctly goes to latches onto your tabular column and finds the gist of your understanding, and your marks will increase. Okay, so that will be about the long question. And for short answers, there are 2 important questions in the first chapter, which is cell injury and adaptation. So the first will be steatosis, okay, which is nothing but fatty chain. That is very, very important. So, as an example of steatosis, nothing but fatty liver can be described as steatosis. And then exogenous and endogenous pigmentation. See, those who want to write down can write down. Otherwise, also I'm planning to share a gist of these points which I have written down already. I'm not able to share it in the form of screen share, that's all. But later I will share it with Vanishri Madam or even in the group for you all to note down the important questions. Okay. So here there will be a list of questions, and the starred ones are very, very important. And the rest of the questions should be known to any undergraduate student. Okay, that is how I prepared the list of important questions. Okay. So coming to short answers back again, steatosis, fatty liver, exogenous and endogenous pigment. Then again, necrosis can be asked as a short question also. Individual types of necrosis. For example, anybody can ask you to describe cases necrosis and give examples. Can be any form of, can be a 2-mark question, it can be a 5-mark question, or it can even be a essay question, because necrosis is very, very important. Okay. So accordingly, you will have to time. If it's a 2-mark question, they will ask you, like they will pinpoint and ask you, mention 2 types of necrosis. So there you need not write paragraph. If it's a 2-mark question, you have to tailor make your answer accordingly, and you have to manage the time. That is the most important thing in your university exam. Managing the time becomes very, very important. All of you tend to write the questions. You always, when you look at the question paper, what happens is that you look at the question paper, you start writing, or 1 or 2 questions you feel you know very well. So those questions you start answering, and then you finish all your time in that, and then come to difficult, more difficult answers, and you make a mess of the solution. So you should not do like that. You have to sign the question paper accordingly. For long answer, this is the amount of time I will give. And for short answer, these are the amount of time I'm going to disperse and give. Nothing wrong in attempting to answer the questions which you know very well as the first method, but the time should not be, limit should not be exceeded even for the answer which you know very well, because it will take a toll on the answer for which you have to think and write if you keep it late. Okay. So then comes the apoptosis. Apoptosis is extremely important. Okay. So you have to write about the apoptosis, starting with the definition, which is programmed cell death, and the mechanism of apoptosis also is very, very important. And you have to give adequate examples here in apoptosis. You can go back, I don't know which book you people are following, but I would advise you to follow Robbins. And there are mother, father, baby Robbins, isn't it? Baby Robbins is something that you could not read, but I don't know what you kids are following. I would suggest that at least you have to have a concise version of Robbins, and you have to read from it rather than going for a baby, which will give it in the form of points, and it is easy to forget points because you are reading volumes and volumes, isn't it? So when you read so much, so many chapters, if you read everything from the baby, everything simply evaporates just like that. But Mother Robbins gives you the concept and a clear understanding. So even if you forget the finer points, you will know the entire concept by heart, and you will be able to answer a long answer or a short answer precisely. Okay. So then comes the difference between necrosis and apoptosis. That also is apoptosis is extremely important. I'm underlining again and again. Necrosis is very important. Apoptosis is extremely important. You will have to study about that. And then comes the gangrene, types of gangrene, wet gangrene and dry gangrene. So here again, like in necrosis, you will have to describe about the dry gangrene, the causes for dry gangrene, the pathophysiology of the disease process, how does it appear morphologically, and then as a summary, the difference between dry and wet membrane can be highlighted. Always ensure that the exam answer is given in the form of points. Okay, you subcategorize the question into different subheadings. Give it catchy heading. Catchy headings means relevant catchy headings. Okay, anything can be catchy, but you cannot put something which is irrelevant in your answer. Okay, so put it in the form of, jot it down in the form of subcategorization or subheading, and under the subheading fill up the points one after the other in a neat and precise manner, followed by a summary which will tell the difference between the dry and wet. And then comes pathological calcification, which is also extremely important. That can again be divided into dystrophic calcification and metastatic calcification. So that also can come as a short answer. And then metaplasia. Okay? Metaplasia, hyperplasia, and dysplasia. Among that, metaplasia is very, very important. You have to describe the metaplasia, define it, describe, and like you have to write down metaplasia with a lot of examples. Okay. So what are the examples for metaplasia? One example I will give you just to make it interesting. GERD, the patient comes to you with a upper epigastric pain. This is epigastrium is upper. So epigastric pain, upper abdominal pain, epigastric pain. And one of the reasons for this epigastric pain is the gastroesophageal reflux, isn't it? So that reflux causes the acid to erode the esophagus. Acid has to normally be in the stomach, isn't it? So instead of remaining in the stomach, it goes up into the esophagus, beyond the sphincter, lower esophageal sphincter, causes erosion of the esophagus. There, the squamous epithelium, which is normally present, becomes metaplastic into a gastric epithelium, isn't it? So that's an example. The normal cell becoming another normal cell, which is not inherent to the place of origin, is called as metaplasia. So like this, you have to define and you have to describe with a lot of examples, and if possible, you can put a few pictures also. So hide and change samoma bodies and hyperplasia or the other stuff. Okay. Hitesh, are you there? Have
Yes,
you all
ma'am.
slept? You are there. What about the other? This finishes one chapter for me. So you can please speak something so that because otherwise I myself is I think I'm sure I'm going to doze off. So please say something. This is the first chapter. Anything more or any other doubt? Anything to be added?
Yes, ma'am. I think you have covered the first chapter for me.
Okay, so shall I move on? Any input from the participant?
Hello, ma'am.
Yes, yes.
Ma'am, can you tell basic points about exogenous and endogenous pigments, ma'am? That short note question.
Yeah. So exogenous and endogenous pigments. Example shall I give you? Will that be fine for you? Hello. Can you
Yes, ma'am.
introduce yourself? Yeah. Can you introduce yourself, Pa?
Ma'am, I'm
Hello,
Harihara Sudan, ma'am, from Coimbatore Medical College, ma'am.
Very nice to hear you. Okay. So an example for endogenous pigment is a lipofusion. Okay. Lipofusion pigment is the endogenous pigment. It is otherwise called as a wear and tear pigment. Usually it is present in the colon. Okay. So it's golden brown in color. And this usually gets enhanced. I told you it is a wear and tear pigment, isn't it? So what happens is that in the colonic biopsy, if the patient has some irritation in the colon, biopsy is taken. Sometimes if the patient has constipation, there is a lot of rubbing of the hardened stool on the lining colonic mucosa. So because of this wear and tear mechanism, this lipofusion, which is a wear and tear event, gets accumulated within the cytoplasm of the colonic lining epithelial cell. Colonic crypt with lining epithelial cell. So this is a classical example of an endogenous pigment. Okay. So exogenous pigment is a formalin pigment. An example for an exogenous pigment is a formalin pigment, which is getting deposited onto the tissue as a result of, it is actually an artifactual pigment which gets deposited onto the tissue as a result of tissue fixation. It is a tissue fixation artifact. Okay. Clear?
Yes, ma'am.
Okay. Any other input? Any other question?
Can you also say about important MCQs from first chapter?
MCQs actually I have not covered, but these are the topics in which MCQs will also come. These are the important topics from which the questions can either be in the form of long answer, short answer, 2-mark question, or even in the form of MCQ. But MCQs, coming to talk about MCQs, there is a tendency when the question setter tends to set a multiple choice question, they will tend to take it from any nook and corner of the book and then give you multiple choice, need not necessarily from the important questions at all. So that is actually a different ball game, which you can get used to by working out multiple MCQ. Multiple MCQ books are available, no? Multiple choice questions are available, right? So that you have to work out and familiarize yourself with. And that time, I can assure you only one thing, that it need not necessarily be taken only from the important topics which I'm telling you. Right? Most of them will come from the important topics only. But there are a certain set of examiners who will always try to avoid the important chapters or important likely questions. The most likely university questions can also be avoided when a question setter tries to set up multiple choices.
Thank you, ma'am.
Thank you. Shall I move on?
Yes, ma'am.
Okay. If there are no questions, I'm moving on to the second chapter, which is inflammation and healing. You can be ready. Once I finish this inflammation and healing also, I will throw it open. The forum open for questions. So at that time also you can ask anything if you feel. Okay. So inflammation and healing, the long questions would be the definition of inflammation and the types of inflammation. So inflammation, I mean, that's definitely a very, very, very important, extremely important question. 100% university question. So types of inflammation also you familiarize yourself, okay, like acute inflammation and chronic inflammation. And they might ask you define inflammation and describe any one particular type of inflammation. Also, they can ask you as one of the long answer. Okay. So, and then describe the causes and vascular and cellular events in acute inflammation. As I told you now, define inflammation, types of inflammation, and write elaborately or write in detail about acute inflammation can be possible, because there the vascular and cellular events are very, very different from what happens in a chronic inflammation. An example for chronic inflammation, if you ask me, it is going to be the granulomatous system, isn't it? So, acute, when they ask you about chronic inflammation, you can describe about chronic granulomatous inflammation. Like example for that will be tuberculosis. Whereas in acute inflammation, the vascular and cellular events are very, very different, because it is going to have neutrophil infiltration, vascular dilatation, and lot of other events which are pertaining or particularly present only in acute inflammation. So, compare with the help of suitable diagrams also. Like acute and chronic inflammation, again, you can put a few diagrams in between to make the answer very catchy and interesting for the evaluator to be impressed by your way of writing. Okay. And also wound healing is there, which is another very, very important question. So wound healing by primary and secondary intention will definitely be asked. And for this, you will have to put a good diagram and discuss the process of primary and secondary injury. Discuss the factors promoting and delaying the process also. See, when they ask you about wound healing, necessarily, of course, if it is just going to be wound healing, then you have to always describe about like the types of wound healing. Primary intention wound healing as well as secondary intention wound healing can be described. And when you're writing about wound healing, always do not forget to mention about the factors which can enhance the wound healing or factors which can delay the process of wound healing, because it's going to be a long answer, isn't it? So you can subdivide the long answer into all these things: definition, types of wound healing, examples for primary, examples for secondary, and what are the factors which are going to affect the primary as well as secondary wound healing can be divided, described, and you can diagrammatically, schematically enhance the description by your picture. Okay. So coming to short answer questions, you can have vascular changes separately. I told you, no, like the define inflammation and then tell me about acute and chronic inflammation can be discussed. I told you. And then I also told you in the long answer, they can ask you to define, they can ask you to subtype, and they can ask you to describe or elaborate one particular type of inflammation. So if it is going to be long answer. But if it is a short answer question, the vascular events of acute inflammation can be a separate question. Cellular events of acute inflammation can be a separate question. Okay. So that information in toto is very important. You have to, every nook and corner, you have to definitely learn. I am here only talking about the long and short answer questions for which it is important. MCQs can also come, of course, needs to say. You people are very interested in multiple choice questions because that is what is going to be asked in your NEET exam or in your competitive post-graduation exams. I do understand that, but MCQ is definitely a different ball game. It comes only by practicing MCQs after MCQ. And of course, after understanding the concept, if you start working out the MCQ, your problems will definitely be much easier than at a stretch you simply start working on the MCQs without understanding the concept of stuff. Okay, so that is one thing. And difference between transudate and exudate can be asked. Chemotaxis is one of the important questions. Phagocytosis. See, all these things are very, very important because these come under a pathology called leukocyte adhesion defect, isn't it? I hope all of you are aware about leukocyte adhesion defect. That is a, or rather to just make your life more interesting, I can say that a patient comes to you with multiple infections, recurrent infections, not responding to any antibiotic therapy, then the treating physician generally suspects the leukocyte disorder. It's called leukocyte adhesion disorder or degranulation disorder. See, any inflammation to happen, all of you are aware, isn't it? The neutrophils should get activated, they should migrate to the site of infection, they have to go and localize and identify the infective agent, and then they have to degranulate or release the toxins which are contained within the cytoplasm for attacking the acute infectious agent. So if any of these steps are going to be abnormal, the patient is going to have recurrent infection, and that is that will manifest as the clinical symptomatology. So, what are the abnormalities which can take place here is chemotaxis. Chemotaxis is movement of the inflammatory cells towards the infectious agent. That can be blocked because of some abnormality in the neutrophil. So, chemotaxis, phagocytosis is eating up or engulfing the infectious agent and destroying it within the macrophage cytoplasm. So, this also can be lacking, and that is again another pathology. So, chemotaxis can be given to you as a short note, or phagocytosis also can be given to you as a short note. So, next important thing is, this is very, very important from our day to your day, of course, chemical mediators of inflammation. There is no escape at all from this question. Either in your internal assessment, you must have been asked already by now, and if you had escaped so far, definitely there is no escape for you in the university examination because it is an extremely important question. Okay, and inside the chemical mediators, you have a lot of things. Arachidonic acid metabolites can be separately asked also. Entirely chemical mediators of inflammation can be a question, or inside the chemical mediators, any one particular type of mediator can be picked and chosen, and it can be asked as a separate question. For example, arachidonic acid metabolites, which also is extremely important among the chemical mediators. And then comes the role of complements. Complements, again, I'm telling you now itself. If you see, I told you chemical mediators of inflammation, you have no escape when you are in your second year. But role of complement, in your lifetime, you cannot. Even if you escape this university exam, even multiple times, even in your next year or even your final year in your house surgery, in your NEET PG exam, and even after you finish your post graduation, you will have to remember this complement throughout. As long as you learn complement, you cannot escape. So learn the complement system now thoroughly and write it in your exam clearly if you are asked about it. This is very, 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 very okay. And then I told you about chronic inflammation. So instead of asking you about chronic inflammation, they can pose a direct question called granulomatous lymphadenitis. Describe granulomatous lymphadenitis. What is the condition which is associated with granulomatous lymphadenitis? Or they can simply give you as granuloma. Describe a granuloma, wherein you have to have a schematic diagram, and you have to also say that this is a type of inflammation which happens in tuberculosis, and of course the other things which are a type of chronic inflammation also you have to make up. Okay, and then neovascularization or angiogenesis can also be asked as a short answer. Factors influencing wound healing also can be asked as a separate. So in wound healing, I told you primary intention, secondary intention, and all those things, isn't it? So along with that, you can write, or separately also this can be asked. What are the complications of wound healing can be another short answer. Granulation tissue. Granulation tissue, it can either be kept as a slide in your practical exam, in your university exam, or it can be asked as a short answer question, for which you have to again put pictures, vocabulary, surround inflammatory cell, and then you have to describe, define, and then you subcategorize and write it correct. And then what is the difference between infection and infestation? It can be another short answer question. Not as important as the ones which I was telling you so far, but it has been asked previously as one of the university exam short answer question. Okay. So under infection again, can we take a short half a minute break? Are there any questions before I get into infection? Are you there?
Yes, ma'am.
Yes. Any comments in between? Any comments or shall I go on?
Yes, ma'am. You can, ma'am. Yeah. So under infections, morphology of tuberculoid leprosy, morphology of lepromatous leprosy. Lepromatous leprosy is extremely important, more important than tuberculoid leprosy. And then the difference between tuberculoid and lepromatous leprosy. And as I told you initially, granuloma as such can be a short answer question. Congenital syphilis can also be a short answer. So among all these things, lepromatous leprosy is even more important than the other questions with regards to infections I mentioned. Lepromatous leprosy is considered to be very, very. So hemodynamic disorders I'm coming to. Is everyone listening, or should I like convey this in some other manner, or is it okay? Any comment? Hello. Yes, ma'am.
Yeah. Is this how you all want it, or should I change the methodology of telling you the part? இப்படிதான் பண்ணுமா இல்ல வேற ஏதாவது சொல்லணுமா? Silence is not okay.
We are okay with your style, ma'am.
All right.
Ma'am,
Thank you so
share
much for
any
responding.
PDF in the group, ma'am.
Yeah, definitely I'll share. Definitely I'll share. Only thing is I'm not able to share the screen as of now through WhatsApp as. Otherwise I would have done that like there. All these are in the form of pictures, but I'm not able to share it on.
Hello,
So,
ma'am.
or now you could make. Hello.
Ma'am, I feel like you are saying questions, ma'am, but if you say some one or two extra points, it will be nice for revision. I feel like that, ma'am.
That's okay. Yeah, that is okay. That's a good idea. I will do that. So, shall I start from the remaining questions? Like till now we have finished till the infections. Yeah. So
Remaining questions, ma'am.
Sorry.
Yes, ma'am. From remaining questions, you can say.
Yeah. Okay. So etiopathogenesis of endotoxic thromboembolism in hemodynamic disorders on the top. So thromboembolism in shock in starting. So shall I ask you a few questions here and there also, so that you also get to talk? Otherwise, I'm not really understanding or whether getting into your mind. So I will here and there ask a few questions also if you all don't. Is that okay?
Yes, ma'am.
Okay. So if you all don't talk, then log off. Okay. So etiopathogenesis of endotoxic or septic shock. Okay, that's one of the important. Okay. So what is a septic shock? Does anybody know? Septic shock is basically
Caused by the bacterial toxins.
Yes. Any other reason? It is basically because of infections, predominantly bacterial infections. Okay. It is not that any other type of infection is not able to cause a septic shock. That's the concept should not be taken as a take-home point. So basically, commonly it is because of bacterial toxins. Okay, but other infections can also give rise to this septic shock. Okay, so that has to be remembered. And what are the manifestations of septic shock? When do you suspect a septic shock? So the patient comes.
Cold, cyanotic.
Yes.
clammy skin.
Yes. Yes. So, when the patient presents in the OPD, as you rightly said, the diagnosis will be shock. That's all. Okay, but you will not know that the patient has a septic shock. So, how will you find out that it is only a septic shock and not other types of shock? There are other types of shock, isn't it? So, actually, when we asked university questions, when I was in one of the medical colleges, Stanley Medical College, I think it's coming making a rounds on WhatsApp. Actually. What is shock, Abdina? Students kind of put a picture like a person was shocked to look at something and like it was a different, the answer was not pertaining to the, it was an entirely different perspective. It is circulating as a joke. Okay, so let's not talk about that. All right. So the patient will come in the form of shock only. Okay, the symptomatology signs will be similar for all types of shock. Okay, the shock can actually be because of vascular causes or bleeding, or it can be because of neurogenic reasons, or it can be because of bacterial endocarditis. Okay, so to distinguish between these things, what is the clinical diagnostic test you will try to do? Anybody? Anybody here? Actually, bacterial endotoxin, somebody told, right? Directly the answer was given as bacterial endotoxin. So for that, blood culture or blood culture will be the diagnostic test which will cleanse the correct diagnosis. Even otherwise, other signs and symptomatology have a septic shock, the patient will have fever. Okay, fever generally in a neurogenic shock or when the patient comes down with a hypovolemic shock as a result of bleeding, the patient generally does not have fever. But in a septic shock which is caused by bacterial endotoxin, the patient will have fever and other signs and symptomatology. Focus of infection also will be there for us to make a diagnosis. After which, culture will cleanse the diagnosis of shock. Okay. So, short answer questions. Moving on to short answer questions. Define and describe the pathogenesis of thrombus. Add a note about the fate of the thrombus. Okay. So, what is a thrombus? You need to make a distinction between what is a thrombus and what is the difference between a thrombus and an embolus. What is the difference between a thrombus and embolus? Can anybody highlight?
Embolism is the part of thrombus that detach and spread in blood vessels now.
Yeah, so moving thrombus is called as an embolus in other words. Okay, so embolus is nothing but a moving thrombus. Okay, so define a thrombus means you have to tell about the layers of the thrombus and how a thrombus is formed. Okay, generally a thrombus is formed because of, see here again you will have to talk about the procoagulant and anticoagulant mechanisms in the blood, isn't it? Hemostasis is called hemostasis, is it not? So hemostasis is nothing but there is a balance between the procoagulant and anticoagulant mechanisms in the blood. So whenever there is an enhancement of the procoagulant activity and there is a reduction in the anticoagulant activity, a thrombus is formed. So that's the basic concept of formation of a thrombus. So here, when you are writing about the causes of thrombus formation, you have to write about the causes which can enhance the procoagulant activity. Okay. So what are the causes for enhanced procoagulant activity in the blood? Anybody? Anybody? An example for enhanced procoagulant activity is stasis. Okay, so deep vein thrombosis occurs as a result of stasis. Stasis of blood. Prolonged period of stagnation of blood at one particular point. That is called stasis. Okay, so stasis is one of the important factors which can enhance the formation of a thrombus. Okay, so when I spoke to you about reduction in the anticoagulant activity, anticoagulant activity is the activity. Anticoagulants are the substances which maintains the fluid form of the blood. Is it? So whenever there is a reduction in the anticoagulant activity, and like in case of protein C or antithrombin 3, these are all anticoagulants, isn't it? So reduction in all these anticoagulants will also increase the procoagulant activity, and this also results in thrombus form. Okay. So what happens? What is the fate of the thrombus? Is basically a thrombus is formed. Once the thrombus is formed, what all can happen to the thrombus? It's called as the fate of the thrombus. So this thrombus can move and go to a different place. This is nothing but an embolus. Moving thrombus, I told you already, is the embolus. And the other things which can happen to the thrombus, it can cause, it can get live. The thrombus can undergo it can organize itself and it can be absorbed onto the blood vessel and the flow can again be maintained. Okay. So these are all the complications or rather these are all the things which can happen to a thrombus after it forms. Okay, and then comes the edema. Discuss the causes and pathogenesis of generalized edema. Okay, so what is edema? Can anybody highlight? Yes, anyone?
Interstitial fluid accumulation.
Yes. Accumulation of interstitial fluid is called edema. So what are the causes of interstitial fluid accumulation? We should know. So there are multiple causes, cardiac causes and non-cardiac causes. So this again, when you study it in general pathology, it could be boring, but when you start looking at the cases and then start evaluating, a patient comes to your OPD, isn't it? So when the patient has an edema, you need to find out what is the type of edema the patient comes to you with. And then only you can read the cause and then the edema subtype. So this edema can either be cardiac causes because of cardiac causes or it can be because of non-cardiac causes. By non-cardiac causes, I mean there could be a cause which is involving the kidney or other reasons are also there. So simplify it and just putting it as cardiac and non-cardiac. Okay. So these are the causes for, I mean, you have to list out the causes for edema and the pathogenesis of generalized edema also. So in cardiac causes, what are the okay, there is a cardiac problem, but what is the exact pathophysiology which gives rise to accumulation of fluid in the interstitium? Okay, so that's the pathogenesis. So you will have to list out the causes and then you have to write down how the cause leads to the effect which is the edema. Okay, and then embolism. Embolism also is one of the important questions, and different types of embolism also is one of the important questions. So what are the different types of embolism you are aware? Anybody?
Ma'am, it can be solid, liquid, and gas, ma'am.
Yeah, solid, liquid, and gas. Solid, yes, agree. What is the liquid embolism?
Ma'am, amniotic fluid embolism, ma'am.
Very good. And then gases?
Gas is air embolism.
Yes, yes, yes. So very nice. So these are the types of embolism and examples you will have to give, like how you said now. Okay, example of a liquid embolism is amniotic fluid. And when does it happen? Amniotic fluid embolism does not happen with all the mothers who are undergoing this process of delivery. Is it not? It happens only in certain instances and it is not happening in other cases of parturition. So what are the predisposing factors for each and every type of embolism? What are the examples for each and every type of embolism? All those things should be okay. And then chronic venous congestion of lung is important. Chronic venous congestion of liver is important. So what do you mean by nutmeg liver? Anyone?
Alternative dark and light bands present in the liver, ma'am.
Yeah. So what is the cause of alternative light and dark bands in the? What is the reason for? Can you explain?
Because of CVC liver.
Yeah, for series liver only, ma. So there is congestion in the liver. What is the reason for the lighter area? What is the reason for the darker area? You rightly said no nutmeg. See, now what is the nutmeg? Anybody know what is the nutmeg? Nutmeg. It has two areas, lighter and dark. Okay, so what is the reason for the lighter area in the liver? CVC? You are in the condition of CVC. And what is the cause for the darker area of the liver? So that is for homework for you. You can go read it up. Okay, and then air embolism as such is an important. Okay, embolism, the types of embolism we did discuss, but air embolism can be asked to you separately. And then infarction is another important. Like how I told you, necrosis is very important. Infarction also is an important. Different types of infarct also is very important. Okay, what are the types of infarct? Anybody? Anyone?
Red and
Anyone? Yes, yes. Red infarct. Where does it happen? Where does it happen?
White film will be there in the end organs, ma'am, mostly.
So, and then what is the type of infarct which can happen in the spleen? Spleen.
White
White, ma'am.
Yes. Why is it so? Any idea why white infarct only happens in spleen and red infarct doesn't? That's again a homework for you. You can take after studying. You can
Single blood supply, ma'am.
arterial occlusions causing white infarct, ma'am.
yes. Very
And it's an end arterial circulation present in the spleen, so it will be in white.
yes. So what is the shape of the infarct in spleen?
Wedge shaped,
Wedge
ma'am.
shaped, ma'am.
Yes, wedge shaped with the broader base towards the capsule and the pointed edge towards the artery, which is gotten the block in the blood supply. Okay, and then some immunopathology, acquired immunodeficiency syndrome is a very important question. And then amyloidosis also is a very important. So amyloid, what kind of revision do you want in amyloid? Amyloid is nothing but a misfolded protein. AIDS also, of course, HIV, I think all of us must be aware of AIDS and HIV. Here you have to talk about the many things, of course. The human immunodeficiency virus, whether it is a DNA or a RNA virus, what type of capsid it has, what are the antigens which are present on the HIV virus, and what is the type of reaction which is elicited by the HIV virus. And again, of course, clinically important thing is the CD4 cell count. It's an immunodeficiency. It is the immunodeficiency which affects mainly the CD4. So the CD4 count is the most important thing. It keeps on happening in a patient who is suffering from HIV infection, and that tells the progress of the patient or progress of the illness in a patient and how good the immune system is. So periodic estimation of CD4 cell count is something which is being done in a patient who has got AIDS. If anybody is aware of that, fine. If you are not aware, make yourself aware because it's very, very important from a clinical standpoint. And amyloidosis is nothing but misfolded protein, and you have the P protein, and the types of amyloidosis also is very, very important. Causes for amyloidosis, pathophysiology, pathogenesis of amyloidosis is also very important. Amyloidosis, you all, I think, are aware that it is not a single disease. Is it a single disease or not? Of course, I've given you the answer. Still, for those who have not been listening to me, is it a single disease or it's a combination of? Anyone? Anyone? Amyloidosis. Madan is there, Pranav Rajan is there, Ankit Ragesh, who is going to give me the answer? Is it just one disease or is it a combination of multiple diseases? Divya Lakshmi, Kamini, Usha, Lakshmi Narayan, Aparajita.
It's due to the combination of many diseases, ma'am.
Yes, like, can you just give one or two examples? Can it occur? Okay, I'll ask you a simple question. Simpler. Can it occur in light chain restriction? In myeloma, can it occur? It can occur in myeloma. It can occur because of aging. In aging, it can occur, and there are multiple other reasons for amyloidosis also. I'm just giving you 2-3 examples. But otherwise, it is a very, very wide topic, multivariate, lot of pathology. And again, there are manifestations of amyloidosis because it is a multi-system disorder. Okay? So this amyloid protein can deposit in any organ, and depending on the organ in which it deposits, the clinical manifestations will be. For example, if this amyloidosis is depositing in the heart, in the cardiac muscle, in between the cardiac muscle, the contractile ability of the heart is jeopardized, and this results in restrictive cardiomyopathy. Okay, restrictive is because there is a restriction in the contractile function of the heart, so there is restrictive cardiomyopathy. So amyloidosis is very important. And then coming to short answer, short question, opportunistic infections in AIDS is also very important. Here you have to subcategorize it into bacterial, viral, fungal, and parasitic infections, and then you start describing about each and every. categories infection is opportunity. Okay? And opportunistic infections in AIDS are basically because of season of the market, depletion of the T cells in AIDS happens. And that is the reason infections are rampant and they are not being fought adequately by the body as a result of lack of CD4 and circulation. Okay, and then hypersensitivity reaction is also important. All of there are how many types of hypersensitivity reactions are there in Robert? You know what? Yes, there are 4 types of hypersensitivity reactions, and each one of them is very well. Type 1, 2, 3, and 4. All of them are. And then there is something called autoimmunity also, which again has to be studied, and SLE, systemic lupus erythematosus, is very, very important. And one more thing which can be asked in the short notes or even during your practical session, LE cell. Okay, SLE is of course a systemic disorder, and then there is something called LE cell, which also is very important. It can even be asked in your oral or during your practical, or it can come as a short answer or even as an. Okay, what is an LE cell? Anybody can answer? They say, I think I have to turn back to you. No one is answering.
Ma'am?
Yes. What is an LE cell?
LE, lupus erythematosus.
Yeah. So what is LE cell? LE cell is a component of lupus erythematosus. No, that's an important question I'm telling you. So what is an LE? It is nothing but a macrophage which is engulfing another WB. Okay, so that is an LE cell. And there is a procedure for demonstration of LE cell which you will have to go back to your practical study and answer in the. And there is GVHD, which is also very important. And staining of amyloid is also. What is the special stain which is used for staining amyloid anyway? Congorid is the stain which is used for staining amyloid, and you can use the polarizing microscope, which will also help in aiding the diagnosis of amyloidosis. So, Congorid is the special stain. To see on morphology is suspect amyloidosis. The special stain which is used is the Congorid, and after application of Congorid, you have to use the polarizing microscope to see the birefringent apple green birefringent amyloid, which is a clinching feature for making a. Shall I move on to neoplasia?
Yes, ma'am.
Yeah. So what do I do? Shall I share the PDF or shall I read the project? I think attendance is very good. 27 only are there. So is this the way you people do also? I don't know. I'm trying it out. Or should I share the PDF? Or should I read the, or should I explain as I'm doing? How do you usually do?
Ma'am, you can share it in the group, ma'am.
நான் படிச்சிருப்பா அப்படியே. See, different metastasis describe its mechanism. Okay, that's one of the long answers. And short questions is dysplasia, root of spread of malignant tumors with example, oncogene, tumor suppressor gene. And then types of carcinogenesis also, like chemical carcinogenesis, radiation oncogenesis, and viral oncogenesis. Each of that can be a short answer. And then you have paraneoplastic syndrome, which can be a short answer. Nutritional disease. Short answers can be enumerate the cancers associated with chronic smoking, enumerate the cancers associated with chronic alcoholism. Obesity is again a short answer. Vitamin A deficiency, rick, osteomalacia, scurvy, or all short answers. Basic diagnostic cytology also has been asked a couple. Okay, and apart from basic diagnostic cytology, you can have exfoliative cytology, wherein pap smear can be asked. What is a exfoliative cytology, it is a cytological examination of the cervical smear. Pap smear is used for cervical cancer screening, and it is one of the projects which has been taken up by the government. So that can be very frequently. Okay, so pap smear is a very important. And apart from exfoliative cytology, fine needle aspiration cytology also can be asked as the important. Okay, and then comes hematology. Okay, hematology is the next chapter. So in hematology, disorders of red blood cells can be asked. Okay, in that, define anemia is a very important question. What are the types of anemia can be one of the important questions. And coming to types of anemia, you have to describe what are the types of anemia, whether it is because of blood loss, whether anemia is nothing but reduction in the hemoglobin. Is it not? So this reduction in the hemoglobin can be because of multivariate reasons. One of the reasons is blood loss. Another reason is the hemoglobinopathy. That is decreased production, increased destruction. These are the two conditions which can give rise to reduction in the hemoglobin. So decreased production can be because of nutritional deficiency. Increased destruction can be because of hemolytic anemia. So hemolytic anemia can be a separate question. Nutritional anemia, which is causing decreased production of RBCs, can be a separate question. In that nutritional deficiency, iron deficiency anemia can be a separate question. Vitamin B12 deficiency anemia can be another separate question. Okay. And leukemia. So next is leukemia. RBC disorders I have told you. And next will be the WBC disorder. In that you have to define and classify leukemia, discuss the peripheral blood smear findings and bone marrow findings for any acute myeloid leukemia. Okay, acute myeloid leukemia is one of the very important questions which has been asked multiple times in the multiple university. Okay, so it can either be asked to define and classify anemia, define and classify leukemia to discuss in detail about acute myeloid leukemia, or it can be asked to define and classify leukemia and describe in detail about chronic myeloid. So short answer questions are leukemia reaction. It can be neutrophilia, eosinophilia, causes for monocytosis. And one another important question which has been repeatedly asked is the Philadelphia chromosome. Philadelphia chromosome, all of you must be aware that it is a part and parcel. It is a defining feature for chronic myeloid leukemia. So, need not necessarily be a straight question like chronic myeloid leukemia. You can have a short answer question as Philadelphia chromosome alone. And what is the blood picture of chronic myeloid leukemia? Also is one of the frequently asked questions. The blood picture of chronic lymphoid leukemia also is one of the frequently asked. Multiple myeloma can be with the laboratory findings of multiple myeloma. And then types of Reed Sternberg cells can be a question in Hodgkin's lymphoma. And you can have the fastest for lymphadenitis. And one more question in relation to multiple myeloma, Bence-Jones proteinuria. So what is Bence-Jones proteinuria? How do you diagnose this protein? What is the test which you have to do in the urine for Bence-Jones protein? Can be causes for thrombocytopenia can be a question. Idiopathic thrombocytopenic purpura can be. So we have moved on to the platelets from RBC to WBC to platelets. So in the platelets you can have idiopathic thrombocytopenic purpura. And in coagulation disorder, the questions which can be asked are hemophilia A and von Willebrand. Okay. Disseminated intravascular coagulation also is a very important question that can come either as a long answer or as a short answer. So DIDC is disseminated intravascular coagulation. The etiology pathogenesis of disseminated intravascular coagulation will be asked. What is the clinical picture will be asked. What is the complication will be asked. What are the morphological factors in each and every organ which is affected by DIDC? Types of anticoagulants used in hematology is also another important question. One important anticoagulant which you should describe about is the EDTA, the ethylene diamine tetraacetic acid, or like ACD. There are multiple anticoagulants, and the commonest anticoagulant is the EDTA. In the blood bank, a different type of anticoagulant is used, whereas in hematology laboratory there is a different type of anticoagulant used. So, microscopic examination of urine is one of the important questions. Microscopic examination of CSF is also another important. So these are body fluids, and the examination of these body fluids can be one of the short answer. Okay. So what is the stain which can be used for peripheral staining? Also, what is question? What is the Buffy code? What is the Buffy code? Anybody? I don't know. Nobody is giving answer. So I'm just going on to question. One child asked me to describe each and everything in detail so that there will be a revision kind of a thing. But if I do that, the whole general pathology questions cannot be covered in one session of 1.5 hours. And I don't know if that is the agenda of today's class. What I was told was to highlight what are the important questions, because you people are exam going and you may not know which one to concentrate and which one to ignore. And if you don't know that, you will end up reading a whole lot of Robbins and getting the that you're not able to complete the Robbins is number one. And you won't remember anything, whatever you read, you see immediately gone on, it will evaporate and you will not remember. So I understood that these are the two important things which made me Bhavanashri Madam contact this meeting. And that is why she asked me to list out the important things. And that is what I'm doing currently. A little bit of explanation here and there is possible, but describing each and everything in detail is not the agenda of this class. Okay, so that for that I think you will have to separately kind of concentrate on each and every particular topic, one particular topic or one particular chapter in topic. Then we can elaborately about that and review everything. Okay, osmotic fragility test also is one of the important questions. Proteinuria, causes for proteinuria, causes for glycosuria, causes for ketonuria, all these are other important. Okay, so now moving on to blood banking and transfusion. Are you there, Parth? Shall I continue? Just a few
Yes,
more
ma'am.
important questions and we will be done.
Yes, ma'am. Yes, ma'am.
I don't know, I'm really not sure if I'm addressing the agenda of this class, but I'm just moving on because nobody is giving me any answer. Okay. So blood grouping, methods of blood grouping. Bombay blood group is one short. The blood donor selection criteria is another short. So moving on to cardiovascular disorders, long answer question is define atherosclerosis. What is the etiopathogenesis of atherosclerosis? This again you have to describe the causes for atherosclerosis, modifiable and non-modifiable factors, and then the like complications of atherosclerosis, and how does the atherosclerosis develop? How does it look? You can picture. So put a picture. You can do a schematic representation. And what is the age at which atherosclerosis starts and the complications? Thereon, you have to elaborate when you're writing about the matter. So describe the morphology with the label diagram. Describe the complications of. So these can be one part of one long answer, or these can be split into multiple short answer questions, and also can be asked. Then comes classify myocardial infarction. Okay, myocardial infarction again is a very, very important question. Atherosclerosis and myocardial infarction, followed by infective endocarditis and rheumatic heart disease are extremely important in the chapter cardiovascular disease. And moving on to lungs, emphysema is very important. Types of emphysema also very, very important. And in the lung, bronchiectasis can be a long answer or a short answer. Lobar pneumonia can be a long answer question or even a short answer question. Tuberculosis also is very, very important. Tuberculosis can either be long or short answer. And in tuberculosis, it can be split up and asked as primary tuberculosis, secondary tuberculosis, gone complex, gone focus also can separately be asked. Okay. And asbestosis also is one of the short answers. Classify lung tumor is another important question. So under lung tumor classification, you have to classify them into first squamous cell carcinoma, adenocarcinoma, small cell carcinoma. You have to, when you are asked about discuss the pathogenesis and morphology of lung tumor, you have to in detail write about the causes and the pathology and the cross appearance, microscopic appearance of each and every tumor, and draw diagrams wherever it is appropriate. And okay, so moving on to gastrointestinal tract, the short answer questions are leukoplakia, Barrett's esophagus, peptic ulcer, gastric carcinoma, and Helicobacter pylori. So with this, I think I'm finishing. If I have left out anything, you can let me know. Or any questions or any discussions that you people feel like you.
Ma'am, sorry, ma'am, but it is understandable, ma'am. You cannot say everything in detail in such a short session. Ma'am, my Ma'am, can you hear me, ma'am?
Yes, 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 I'm able to hear.
Ma'am, last time they asked CML and septic shock as essays, ma'am. This time, is it possible to predict anything, ma'am, for essay?
CML and septic shock, huh? Okay. Myocardial infarction, atherosclerosis, yes. You have to apoptosis, myocardial infarction, atherosclerosis, you have to read in detail. And AIDS also can be asked as something for this.
Yes, ma'am.
In the thromboembolism shock, DIVC can be. DIVC is very, very important. That also can be.
Ma'am, the same question can be repeated, ma'am. This time, any question?
No. Immediately after the previous exams, it will not be repeated. Because we generally, while setting a question paper, no, we look at the previous 2-3 exam question papers and ensure that it is not repeated immediately thereafter, and then only repetition unlikely, very, very unlikely.
Yes, ma'am. Thank you, ma'am.
And anything in particular you're finding it difficult, no? Like you know, no, like in general pathology, especially one particular area you have some difficulty that you can assist. I can always explain.
Ma'am, I feel difficulty in remembering peripheral smear and blood things, ma'am, in anemia and also in AML, CML things, ma'am.
Okay. That is actually the easiest portion of pathology is that only I feel because peripheral smear, nothing new. What do you not understand in peripheral smear? Like evaluation of peripheral smear, or which portion do you not?
Ma'am, like remembering, ma'am, what will happen to RBC, WBC, then like that, ma'am.
Mainly, ma'am, like we diagnose the particular patient, like the case history is mostly given in SLE, sorry, AML and all, ma'am. For that diagnosing the particular patient, that is a bit problematic for us, ma'am.
Okay, diagnosis, making a diagnosis.
Yes, ma'am. Like CML,
Okay.
AML, ALL.
Oh, that I will tell you. That is not a problem. I'll tell you what. See, they give a case history for you. Am I right? They give you a case history and ask you to make a diagnosis. Am I right? Is that where you're finding it difficult?
Yes, ma'am.
Okay. So in the case history, see, you told me about leukemia. Leukemias, you're finding it difficult. Acute myeloid, acute lymphoid, and CML, you told me of. Okay, while making a diagnosis, you always remember, okay, in a case history given, you have to concentrate on a few things. First, if you concentrate on those things, you can differentiate between an acute leukemia and a chronic leukemia, which is a very, very important distinction which you all will have to make. Okay. So, for a diagnosis of acute leukemia, what will be given in the question is the patient has anemia, the patient has thrombocytopenia, meaning there is, and the WBC count will be very, very. So the WBC count will be high both in acute as well as in chronic leukemia. But in chronic leukemia, what happens is that the hemoglobin and the platelet count will not be less than normal. It will not be reduced drastically. Whereas in acute leukemia, because it is an acute process, the acutely proliferating, sudden proliferation of WBCs and immature cells will cause, it will actually reduce the number of RBC and platelet precursors. And this will result in anemia and thrombocytopenia and a full-blown increase in the WBC number. Okay, so increase in WBC numbers with acute, hemoglobin content will be less. RBC number will also be less, and the platelet number also will be less. In that case, you can diagnose an acute problem. Leukemia, you have to diagnose it because there is increase in the WBC level. For example, 1 lakh WBC, 2 lakh WBC, 3 lakh WBC. That is leukemia. Okay. But if there is a reduction of the HP content and platelet, you have to suspect an acute leukemia. But when there is a normal hemoglobin, normal platelet count, increased WBC, we can always think of a chronic. Okay. So acute myeloid leukemia or lymphoid leukemia and chronic myeloid leukemia can be differentiated by this methodology. There is acute myeloid and lymphoid. If you want to distinguish between an acute myeloid leukemia and acute lymphoid leukemia, the peripheral blood picture and the bone marrow picture will be given in the clinical sheet which you are trying to read. In an acute myeloid leukemia, the description of cells will be different from an acute lymphoid lymphoid leukemia. In acute myeloid leukemia, the cells of the leukemic cells will show an abundant cytoplasm, whereas in lymphoid leukemia, the leukemic cells, it will be described in the blood picture and the bone marrow picture as having a scanty cytoplasm. The nucleus will be very big, the cytoplasm will be very big. Whereas in acute myeloid leukemia, the nucleus will of course be big, but the cytoplasm also will be abundant. If it shows abundant cytoplasm, it is a myeloid leukemia. If the blast cell shows anti-cytoplasm, it is an acute lymphoid leukemia. Apart from this, there are the number of nucleoli also, which will help you to make it. In acute myeloid leukemia, there will be 5 to 6 nucleoli within the enlarged nucleus. Whereas in acute lymphoid leukemia, you will have 1 or 2 nucleoli in the nucleus of the enlarged. So this is how you make it.
Okay, sure.
Clear
Thank you, ma'am.
or
Yes, ma'am. Thank you.
thank you. Anything else? Any other area which you not able to, finding it very difficult to remember? Any questions? Otherwise, Hitesh has to comment.
Ma'am, can we? Ma'am, hello.
Hello, you're on.
Yes, ma'am. Can we end it in the meeting with Shanti Mantra, ma'am?
Sure.
Yes, ma'am.
Shanti mantra. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः नमस्ते.
Thank you for the session, ma'am.
Thank you so much. Good night to all. Any doubts?
Yes, ma'am. Sure, ma'am. Thank you, ma'am.